Good morning, everybody. I can see people trickling in, so I will wait for everybody to come in. Right, the numbers are ticking up. Hi to those that have just joined. We're just waiting for everybody to log on, and we'll get started in just about 30 seconds, maybe a minute. Okay, it looks like the attendees have kind of come in now, so I will get started. Hello, everybody, and good morning. Thank you so much for joining us on this sunny Thursday morning down here in Devon. So today we are running the Coffee Time QI, all about PDSAs. So in this webinar, before we start, a couple of bits of housekeeping. Do pop your name and say hello in the chat and where you're from. As we go throughout the webinar, any questions that you have, please do feel free to pop in the chat box or the Q&A box. I do have my fabulous colleague Drew on the line with me, and he will be monitoring both the chat and the Q&A, so he'll be able to answer questions as we go through. And I am hoping to finish a couple of minutes early just so we can go over any questions. This is being recorded and it will be sent to you after the webinar has finished, so you will be able to watch this back. So what we are going to cover today is what is a PDSA cycle, the benefits of using a PDSA cycle, tips for developing great PDSA cycles, how to decide whether to adopt, adapt, or abandon, and then also we're going to look at the practical element of actually creating your PDSA and how to ramp that in Life QI. Then at the end, there'll be a slide with all the learning resources available as well. So we will get started. So the first thing, what is a PDSA cycle? So as you can see on the screen, a PDSA is a Plan, Do, Study, Act cycle. It's a 4-step model for improvement. This basically, they provide a rapid way to test out small changes. So essentially what PDSAs do is they provide you a framework for testing, evaluating and implementing a change within your quality improvement project. These help you continuously learn from new experiences. So really, in simpler terms, it can be described as a framework for trial and error. So you're trying things out, seeing what works and seeing what doesn't. When you do run PDSAs, these should be used throughout the whole life cycle of your project. So by running these PDSAs, it's going to help you understand what you're trying to accomplish by having a well thought out plan and objective within your PDSA. It's going to help you know whether the changes that you're testing are actually showing an improvement by ensuring that you're collecting the relevant data and being able to analyze and look at that data in relation to the PDSA. They're also a really great way of ensuring that changes aren't being implemented too quickly and impulsively. So it's allowing you the opportunity to study the changes and the impact of those PDSAs carefully. So the next element is kind of, let's look at the PDSA, the Plan, Do, Study, Act element in a little bit more detail. So these are the 4 elements that make up your PDSA. The plan section is where you agree on the change that you're going to be tested and you plan your actions out for that cycle. So at this stage, you're going to want to identify exactly what your objective is. So for example, are we running a project on reducing pressure sores within our ward? And by running this specific PDSA, we want to help increase the awareness of pressure sore prevention, as an example. It's also a really good idea at this plan stage to kind of think about what measures will be linked to this and kind of what data you're going to need to be able to be looking at in order to see whether this PDSA is having improvement and causing a change, essentially. The do element, this is, as it says on the tin, the stage where you actually carry out the test or the change. So it might be a really small test, but this is where the actual action and the doing of that PDSA takes place. So you have the planning and then the doing. And then what we want to do is we then want to be able to study our PDSA. So study the doing part, essentially. So we've planned it, we've now done it, we've run that test of change. So what actually happened within this test of change? Have we seen any improvement? Has nothing happened? Have we seen slight improvement? So essentially, you're going to want to study the data that you've collected and then review, discuss, and reflect on this with your team about the impact of that change and what it is that you've actually learned within this PDSA. So the last part of the PDSA is the act stage, and this is where you then act on what you have learned and what you have done within your PDSA. So we'll cover this in a bit more detail later, but this is where you kind of pull in potentially the adapt, adopt, abandon element. So are we going to adapt it? So run a different cycle? Are we going to adopt it? So we've seen change, we're now going to implement this change that we've done. Or are we going to abandon it and not progress with it? Okay, so that's the part that we then act on what we have done and what we have learned. By running PDSAs, there are lots and lots and lots of different benefits. So we've got a few up here on the screen. Now, the ones we've got on the screen are by no means the full amount of benefits, but as I've mentioned earlier, PDSAs are often small scale. So we try and encourage people to run small scale PDSAs because one, they're easier to implement, and often they're more well received. So we don't want to go trying to change something absolutely huge. We want to run these in really small increments, implement those small changes, and then over time grow that to be a larger change. We often find that by running PDSAs, it really helps with staff empowerment because one of the natural outcomes is that it is a bottom-up approach. And this is directly involving your frontline staff and gives them kind of the ability to solve problems directly in their hands and make them feel like they're the ones making the change. So we're not doing a top-down approach. We're saying you have to change this. They're coming up with the ideas, they're testing the changes, and then they're studying and acting on whether these have been an improvement. One thing that's great is they're more often than not cost effective because although they are small and simple, that means they're often inexpensive to implement, but the learning payoffs can be absolutely huge, and they're methodical. So it's a really kind of the model itself is efficient and provides that clear process. So basically, everyone's running the same format, everyone's doing the same thing, so it's a nice methodical way of working. But as I mentioned, these aren't kind of the only benefits. We have other key benefits. So, for example, and I mentioned it earlier, when we think about the kind of abandon side of it, it's often easier to actually leave those bad ideas behind when we're running a PDSA. And that's because, as we've discussed, they're often small scale changes. So because these are small scale and they've been implemented pretty quickly and efficiently, they're actually easier to drop if they don't work out. So we haven't spent weeks and months and years of time thinking about this change, implementing it, putting loads of money and resources into it for it then not to work and go, wow, what are we going to do now? So because they are that small, rapid changes, it does make it easier to say goodbye to the ideas that just don't work. And you're going to have ideas that don't work. Not everything is going to work out, but that's the beauty of PDSAs. You can test as many times as you want on a small scale to see the things that actually work and will cause improvement. Kind of in line with that as well, you may find that the changes are less disruptive, and that often means that staff and patients are more receptive to them. You know, I've said it loads, but because we kind of encourage it to be small scale, you're not then causing masses of upheaval. I can't speak, upheaval for your staff and for the patient. So they are often a lot more receptive to them. But also, we kind of touched on it earlier as well, but when you're running PDSAs, it gives you adequate time for testing because you're doing those small scale changes over, a couple of cycles, it is going to stop that or prevent the impulsive change. So ideas can be tweaked and checked for sustainability through multiple PDSA cycles before being introduced permanently. So that means that the changes always support rather than hinder your improvement. So a couple of benefits there of running PDSAs. Like I said, there's lots and lots more, but hopefully that gives you an idea of why we might want to be making sure we are utilising PDSAs within the life cycle of our project. So this is quite a quick, easy slide, but just a couple of tips. So the first thing that we want to think about in that plan section that we spoke about earlier is setting your aim, but really, really trying to be as specific as you possibly can be. So when you think about kind of the SMART aim within your project, you kind of want to do the same thing for your PDSA as well. So what is it we're trying to achieve? Try and make that quantifiable, you know? So are we trying to, by introducing pressure sores prevention materials, do we want to see a 20% increase in the amount of patients that have awareness of pressure sores prevention, as an example? So try and make that really, really specific. One thing that's also really good to do, especially if we're following kind of the process of a project, and we've developed our driver diagram first, is we actually want to align our PDSAs to a specific change idea. So we want to kind of thought about those change ideas earlier in the project and then align it. Also, that gives us a bit more focus. So rather than just being a bit like wishy-washy and not really understanding where this fits into kind of the whole view of our project, we can align that specifically to an already thought out change idea. Set the scope. And I've said it loads, but smaller is often better. So it might be that we're rolling this out we're trying it on one ward, and then we might want to roll it out on 2 wards and then 3 wards, etc., etc. So set the scope to start with. And then choose the right data to measure. And this is really important because this then goes back to the study element of your PDSA. You need something to study to see if this PDSA has caused improvement. So thinking about the example I've been using the whole way through, and we're talking about kind of increasing the awareness of pressure sores preventions with patients on a specific ward, it could be that we survey the patients and we say, are you aware of pressure sores prevention? And then we look at a measure that's the percentage of patients that are aware. So you would look at the total number of patients within a week that have been given pressure sores prevention information. And then over time, we would want to see that increasing so we could see that the number of patients that are aware is going up rather than going down. So really think about that when you're planning your PDSAs as well. How are we going to study this? What data are we going to capture, and how and where are we getting that data from? And then the last element is obviously capturing it on LifeQI, and we're going to go through that later. But then LifeQI provides a really, really good way for you to quickly and easily add in your PDSAs and link it to all of your different areas, so your change ideas and your measurements as well. Another helpful tip that I haven't actually put on here, but that is ideally you would run one PDSA at a time. Now, this relates directly to the testing element, not the developing of the PDSA. You might be developing multiple PDSAs at a time, but when it comes to actually testing and kind of acting on it, try and do one at a time. Now, the reason for this is if you try and run 2 at the same time and the data improves, you're not actually going to be able to identify which PDSA has caused the improvement. So by running one at a time, starting with the most likely to have a positive impact, you will then be able to see whether that PDSA has caused improvement. So, quick water break, sorry. I mentioned earlier when we were talking about the kind of ACT part of the PDSA. And this is what do we do? So we've run our PDSA, we've planned it out really well, we have done it, we've implemented it, so we've done the do, we've studied it, we've seen, okay, so actually, I've got evidence that the plan and the objective have been met and that we have seen an improvement within our data. So we can now start to implement those changes. So that would be the adapt element. If you, at the end of the cycle, see the evidence that there's been some improvement, but you think that actually by tweaking elements, you'll be able to achieve further improvement, you can adapt your PDSA. Okay, so the adopting element is if you've completed it, you can evidence that the plan objectives have been met and you can see improvement. Adapting is at the end of the cycle, there's some improvement, but with some tweaks, we can actually go, oh, we're going to be able to see even more improvement. So again, an example of this, I've been on the pressure sores one, so I'll use that. So thinking about that example that I've used, so we're running a project on reducing pressure sores. We want to increase the patient's awareness of pressure sores prevention. Within our first cycle, we had a look at putting posters up around the ward in the waiting rooms and specific locations within the ward. But then, and we've seen a slight improvement, but actually we know that we could probably see more. So what we're going to do is we're going to adapt that PDSA, run a second cycle where we might look at putting a leaflet or documentation within the patient's admission material. And then the matron or the lead nurse on the ward may also brief the patients on that as well. So we know that more patients are having visibility of that documentation, and that will hopefully mean a higher rate of improvement within our second cycle of a PDSA. So that would be the adapting element. Abandon, that comes back to what we were saying earlier with the benefits and it being easier to say goodbye to kind of the changes that didn't work. So if after running your PDSA, you feel as though there's been no change, you can choose to actually abandon that PDSA and take it no further. You've tried, it hasn't worked, that's fine. We're then going to plan our next one and go on to something else that hopefully will show an improvement. So that's kind of the real theory side behind PDSAs. Now, I'm just gonna, before I go over to the next stage, which is where we look at how to actually create that PDSA in LifeQI, I'm just gonna check in with Drew and see if there's been any questions so far, or if I'm okay to move on to the practical element.
No questions yet, no. Oh, there's one that just came in. How long must the cycle be?
There isn't a wrong or a right thing for that. Obviously, we've seen kind of some tips for benefits and tips for creating great PDSA cycles. They're normally small changes. So the small changes may be quicker, but there isn't really a right or wrong because we know that different things take different amount of time. So just however long it takes for you to be able to execute that PDSA correctly and really understand what that plan is, what you're going to do, etc. So yeah, there's not really a kind of wrong or right answer for that. So what we're going to do, that's no problem. What we are going to do is I'm just going to quickly switch my screen share to Life UI. Now, hopefully, Drew, can you confirm that I am showing the right screen?
You are, yeah, perfect.
Amazing. Thank you so much. Okay. So we are now in LifeQI, and I've been all about the treacherous ulcers examples today, so I'm going to stick with that just because I think it will be easier and helpful. So this is our project within LifeQI. Now it's quite a progress project, as we can see. We're scoring a 4 on our project progress score. We've got a really nice developed driver diagram. We've got our measures laid out, and we've already been running some PDSAs, but we're going to now create a brand new PDSA and run that. So what you're going to want to do is you're going to want to come to your PDSA tab within your project. I'll just give you a quick idea of what the layout looks like. And you can see that we've got multiple ramps with different cycles here. We then have the ability to see which change idea they're linked to, okay? So what we're going to do is we're running a completely new PDSA. So I'm going to create a new PDSA ramp by clicking this button here. So what I'm going to do is I'm going to add in my title, which is mandatory. You do need to add that in. Um, I'm then going to add in my aim. So displaying information on press release, we hope to reduce likelihood of getting sores and awareness of patients by 20%. Okay. We then have the ability to link to our change ideas. So you would have noticed that my driver diagram is already created. So we do need to have the change ideas listed on our driver diagram in order to then link them. So this is going to link to this one, introduce pressure sores prevention information. Who's responsible for the PDSA? Is it me or is it somebody else on my project team within LifeQI? Where is it taking place? So this is Ward A. Now we want to add in what our plan is. Okay, so what is it that we plan to do? So we're going to create posters of information on pressure sores and pressure sores prevention and put up around Ward. Okay. We do then have the ability to build out a task list. So it might be, and we can do this after we've created the PDSA as well, but this might be Sophie to develop poster. Oh, excuse my spelling. I'm always so bad at typing live. It's so funny. I do apologize. So I can then add in kind of detail about that, and I can then give myself due dates. So we actually want to have this done by the 1st of April. Click save. And like I said, we can add these and tick them off retrospectively as well. Then on to the next page. What do we think is going to happen? So this is where we're going to add in our prediction. Okay. Then we want to link our measure. So what measure are we trying to impact? And this for me is going to be, I don't know if we've got the right one. We haven't. But say, for example, we had a measure that was number of patients aware of prevention of pressure sores. You would then link it to that measure. And then we're going to create our PDSA. So this is then your PDSA format within LifeQI. Super simple to follow. You've got your PDSA tab at the top, your tasks next to it, where we can tick off tasks here. We can create new tasks. So I find this particularly handy because I do end up having kind of 1,000,001 to-do lists. And if I just keep everything for this project in here, I do find it super, super handy. So do utilize these task lists. Back to the PDSA, the top element is everything to do with the plan that we spoke about earlier. So really understanding what we want to achieve and what our objective of this PDSA is, which change idea it's linked to, what our prediction is, etc. We then have the ability to see our linked measures. Now, what we can do is we can actually click straight through to our from our PDSA to our measure here. So we can then go and have a look at our data from our PDSA as well. So that's nice and handy to know. Then at the bottom is the do, study, act elements of LifeQI, of the PDSA, and this is where you'll add it into LifeQI. So once you have kind of done the do, you've been testing the changes, you can then add in here what actually happened. So for me, the plan was executed as described, posters were created and placed in the waiting area and around the ward. Now we're going to study it. So what actually happened? So while we saw some improvement, results were less positive than hoped, but initial predictions have been identified as optimistic. So we're saying, okay, we saw some improvement, but we can probably see some more. And then we're going to do the act. So again, this goes back to the thinking about the adapt, adopt, abandon element of it. So what we're going to do next in this one is we're actually going to run a second cycle. So we're going to adapt this ever so slightly, and we're going to make that information more accessible and ensure all patients receive an information pack. Okay, so that's my what is next. So I'm just going to click save there. So this now is a completed PDSA cycle in LifeQI. So as I mentioned, we then want the ability to ramp that PDSA and run a second cycle. I don't want to create a brand new PDSA ramp because this is actually a second iteration of this PDSA. We are just adapting it slightly. So in this scenario, what I would do is I would actually click this create a new cycle at the button at the bottom. We're then going to be taken through the same setup steps, but we have the ability to change anything that we need to. Okay. So my title changes slightly because we're actually adding the information into the admission paperwork. My aim stays the same. My change idea stays the same. My person who's responsible and location stays the same. But then my overview and notes might change because we are adapting this slightly. So in here, I'm then going to want to add in my new kind of plan. What is it we're going to do? Again, we can add tasks, but we don't have to do that now. We can do that when it's created. And then is our prediction going to change? I actually think it will, because I think by giving this in our admission packs, more people are going to be made aware of pressure sore prevention, and hopefully then we'll see a larger proportion of people having awareness. And then we create that cycle. What you'll now be able to see, my title has changed at the top. We have currently on cycle 2 out of 2. I have two little graphics here. One is fully kind of filled in, which is showing that's a completed PDSA cycle. And one here has 3 grayed out little segments, and that's showing me that, yes, we've done the plan, but we actually haven't yet done the Do Study Act, okay? We then have the ability we can create as many cycles as we need. So if you need to run 10 cycles, you need to run 10 cycles. If you need to run 20, you need to run 20. There's no limit to how many cycles you run. And you do have the ability to switch between the cycles within LifeQI. And the way you would do that is on the Actions button, Previous Cycles, and then flipping between the 2 different cycles, okay? And you would just do that for however many cycles you had. It's worth noting that it will always, in the PDSA area, show you the most recent cycle, okay? So the title of it is going to be the most recent cycle that you are working on. It won't show the first one, it will show the most recent one. So that is how you run a PDSA. Now, the other thing that you can do is just really quickly, if we come into our measure, what we can do is we can actually link our PDSA to specific data points of when that started to then see if there's been any improvement within our data. So, sorry, you can hear my dogs. So here we're on our chart. I'm going to click edit, and then I'm going to click on a specific data point that my PDSA started. I can then, on the PDSA, choose the correct one, and then you simply click off, and then we have our PDSA linked. So I can now see that actually there's been a shift in my data since I started this PDSA. Okay. And that goes back to the tips that we spoke about earlier of only running one at a time, because if I had multiple PDSAs running at the same time, I wouldn't know which one was actually affecting my data and causing me to see that shift in my data there. But that is the practical element. So let me just come back to here and go, okay, perfect. So hopefully, again, I'm sharing the right screen. But any questions at all? Anything that didn't make sense? Anything that you'd like to go over?
So there is a question on here that says, do we include DSA steps resources written in P phase as planning?
That as in, do
Uh,
you add in the do study accept resource, etc. in P phase as planning?
yeah.
So in the planning phase, what you would be doing, basically, yeah, because what you'd want to be doing is saying, okay, so the objective of this PDSA is this is what we aim to do. How are we going to do it? And then the prediction element is kind of what we think is going to happen. And you can say, we're going to study this to see if it's correct. Okay. The act element really is just acting when you've run that. But yes, absolutely, you could have those details within the plan section. I hope that helps. Any other questions at
Brilliant.
all?
There's another question that just came in. It would take us over the mark of the webinar though. Basically, the question was, could you please go over the part of creating charts linked to the PDSA?
Yes, no problem. I will do that super, super quickly. Um, so essentially, let me come back here. Okay, so your measures would have already been created and your charts would have already been created. Okay, so what you would then do is you can either access it through your PDSA if you have linked that measure, or what you can do is you can come in to your measures area here. And then on the relevant measure, so my internet's decided to go funny. On the relevant measure, you would click into that, and you would then open up the chart. By clicking edit, you can then highlight the relevant data point where the PDSA is started, and you can then link that PDSA, okay? But as I said, your measure and your chart will already need to have been created in order to do that.
Okay.
So
Yeah.
oh, sorry.
No, that's it. Go ahead. We're out of time
Perfect.
now.
I was going to say that we are unfortunately out of time, and I don't want to take any of your the rest of your day up. But we will be sharing a recording of the webinar. If you do have any further questions, please do reach out to myself or to the help desk, and we'll be able to help you. I'm just having a quick look. I have just seen one in the act is when we'll implement the adapt, adopt, abandon. Yes, correct. So when you're on the act element, so what is it you're going to do next? Are you going to adapt, adopt, or abandon? But I really hope that that's been helpful. Like I said, everything will be sent to you afterwards. Any help, contact us or the help desk. And thank you so, so much for joining today. I hope it was useful and it was lovely to meet you all. Have a fabulous day and hopefully see you very soon. Take care, everybody. Bye.